go on.
Okay, so I've been asked to talk a bit about medicines that can actually help patients like yourself with axial spondyloarthritis. Medicine is one of the treatments that we would offer you, and it will start with simple painkillers. We tend to like anti-inflammatories, but on the top of that, this slide, we've got painkillers, and that would include things like paracetamol and codeine. And we tend to use this a lot more in patients who can't take anti-inflammatories because they've had side effects, for example, or that they have, gut problems such as colitis, where it's not allowed to take these drugs. But things like paracetamol or codeine are potentially commonly prescribed. The anti-inflammatories, which in my experience are usually the best drugs at an early stage, and these would include things like ibuprofen, naproxen, atorvastatin. So a number of you have gone through all of this, and you'll find that in some people something like ibuprofen would work, and others naproxen will work, and others atorvastatin. So it's a trial and error, but the aim is to try these drugs if possible in the first instance. Do we use steroids? We tend not to use steroids for spinal problems. They in my experience, they don't tend to work. We tend to use, if we have to use steroids, more for joints such as the peripheral joints, like your hands, your feet, your knees, if they were to be involved. But in main, we try and avoid using corticosteroids. Then you've got disease-modifying agents. Some of you may be on drugs such as methotrexate and sulfasalazine. And again, these are more for patients who have arthritis or inflammation of joints other than your spine, such as, again, your hands, your knees, your feet, as an example. They don't tend to work in patients who have spinal disease. And then you have biologics, and biologics, I believe, have really revolutionized the management of patients with axial spondyloarthritis. I think biologics have been around in rheumatology for nearly 23, 24 years. And you would have heard of a number of groups of biologics which are targeted drugs, such as you would have heard of anti-TNF agents, which I think a significant proportion of you are on. Then you have the other type of biologics, such as anti-IL-17. That's a type of a group of drugs it comes under. And drugs such as secukinumab and ixekizumab, you may have heard, and some of you may be on. And then there are the targeted synthetic drugs, which are just recently come around for axial spondyloarthritis, and they are the JAK inhibitors, and the specific one that currently has a license is a drug called upadacitinib, and again, it's another drug that's used for this condition. The point here is these drugs are really, I believe, life-changing in a lot of people. And they are not the sole treatment. They, in combination with other aspects of your treatment, is the key message. And the other treatments we're going to get Sean and Naheed will talk to you about.